Hi, everyone. Today we will be presenting on mindfulness meditation as a complementary and alternative therapy in nursing. Our focus is on patient and nurse education, showing how mindfulness can help both patients and providers cope with all areas of stress, anxiety, chronic pain, and chronic illness. My name is Melissa Palumbo, and my partner is Caitlin Catlett, and we hope you enjoy our presentation. Hi, everyone. Today we will be presenting. Mindful meditation is a practice that invites us to slow down and reconnect with our inner experience in a deliberate, compassionate way. At its core, it involves paying attention to the present moment, noticing what may arise, thoughts, emotions, physical sensations, without judging or trying to change it. Mindfulness teaches us to observe our experience with openness and curiosity. By repeatedly turning our attention to the present, whether through breath, body, or sounds, we gradually develop a greater sense of clarity and self-awareness. Over time, this can help us recognize unhelpful patterns of thinking, regulate difficult emotions more effectively, and cultivate a more grounded, balanced approach to daily stressors. Mindful meditation is widely used for its psychological and physiological benefits. It can help reduce stress by calming the body's fight or flight response, lowering heart rate, and improving emotional resilience. Many people use it to manage anxiety by creating space between a triggering thought and their reaction to it. It is also a supportive tool for coping with chronic pain or illness, helping individuals shift how they relate to physical discomfort and strengthening their ability to stay present even when the challenges arise. Beyond these therapeutic uses, mindfulness can enhance focus, improve sleep, boost mood, and foster a sense of overall well-being and inner peace. It is a simple practice in principle, but one that becomes deeply transformative with consistency and patience. Mindful meditation is a So what is mindful-based stress reduction? Mindfulness and meditation have become increasingly integrated into healthcare settings as non-pharmacological interventions for stress reduction, chronic pain management, and mental health support. Programs such as mindfulness-based stress reduction are widely implemented in hospitals and outpatient clinics to help patients manage anxiety, depression, and symptoms of chronic illness. Characteristics such as breath awareness, body scanning, and breathing space are all factors that can bring attention to the natural rhythm, the different parts of the body, and observing current thoughts and feelings, reconnecting to gain clarity and calmness. So what is mindfulness-based stress? Mindfulness-based stress reduction for health promotion and prevention. Advanced practitioners play a key role in early identification and prevention efforts since they often see patients first in outpatient settings. Smoking cessation and dietary behaviors are factors that are now global health issues. With about 1 billion smokers and 6 million deaths annually, quitting is challenging, with fewer than 10% succeeding rates due to nicotine addiction. Evidence suggests that MBSR can support cessation by reducing cravings, improving emotional regulation, and increasing a sense of control. Unhealthy eating patterns have contributed to high obesity rates. MBSR programs can help patients become more aware of hunger cues, emotional eating, and automatic eating habits. Small studies show reductions in BMI and hunger. For eating disorders, especially binge eating, MBSR can reduce impulsivity, eating episodes, and improve emotional awareness, with studies reporting decrease in binge severity, anxiety, and depression, and an increase in self-acceptance. Mindfulness-based MBSR programs can be used for chronic disease management, such as hypertension, type 2 diabetes, and clinical depression. MBSR has shown strong benefits across several chronic health conditions. For hypertension, which affects a significant portion of both the global and U.S. population, MBSR has produced meaningful reductions in blood pressure and BMI that persist months after the program ends. In type 2 diabetes, MBSR is linked to lower HbA1c and improvements in depression, anxiety, and behavior. Finally, research has shown that MBSR significantly reduces depressive symptoms in both patients with major depressive disorder and those experiencing elevated depression related to medical illnesses, making it a versatile intervention across healthcare settings. Mindfulness-based stress reduction is a versatile and effective intervention that helps both patients and healthcare providers manage a wide range of symptoms and challenges. Research shows that MBSR consistently reduces stress across many medical conditions, including but not limited to cardiovascular disease, irritable bowel syndrome, HIV and AIDS, diabetes, and cancer. It is also effective in acute pain management. For example, a 3-day session significantly reducing pain sensitivity and anxiety, suggesting it can be implemented quickly in inpatient settings. For chronic pain, MBSR leads to durable improvements in pain, intensity, coping, and emotional well-being even years after completion. In the area of sleep, studies show that MBSR enhances sleep quality, decreases disruptions, and helps reduce worry that interferes with rest. Importantly, MBSR also supports provider well-being by reducing burnout and stress while increasing empathy and self-compassion, ultimately contributing to a better patient care and stronger patient-provider relationship. Mindfulness-based incorporating MBSR into clinical practice. Advanced providers can integrate mindfulness informally into daily patient care. Nurses can take MBSR courses to learn exercises that they can share with patients. Simple techniques such as guided breath work or body scanning can reduce patient anxiety. Most major hospitals and universities offer MBSR programs for providers, and nearly 1,000 certified MBSR instructors and mindfulness centers now exist across all U.S. states. Incorporating MBSR. There is a growing use of MBSR programs in healthcare. Integrating mindfulness into clinical settings, reducing stress, lowering blood pressure, improving sleep, enhancing emotional regulation and coping. Research all indicates that mindfulness and mantra-based meditation practices produce small to moderate improvements in emotional symptoms such as anxiety, depression, and stress, while also offering benefits for certain physical health outcomes. This helps promote a holistic body, mind, spirit experience. Therefore, applying in chronic pain, anxiety, depression, there is a growing use for MBSR programs in nursing and nursing curricula. Participation in these programs can further enhance overall mental health, well-being, promote relaxation, improve focus, and overall greater mental health clarity. MBSR programs are not only beneficial for just patients, but also supports our own well-being as providers. It supports holistic, patient-centered care, reducing nursing burnout, enhancing empathy and presence, and improves our ability to be fully present for our patients. Mindfulness has been successfully applied across multiple healthcare settings, including oncology, mental health, and chronic disease management. For high-stress populations such as healthcare workers, students, and patients with chronic illnesses, we stand to benefit significantly from the incorporation of mindfulness practices in our plan. Practicing mindfulness and meditation regularly helps healthcare professionals maintain stable well-being, boost their performance and resilience at work. Simple meditation exercises, which require no special environment, can be easily performed in various settings, making them particularly accessible for the provider. MBSR program.
Now moving on to a patient scenario. So this scenario illustrates how mindfulness can be used in real-time nursing practice. The patient is a 45-year-old woman who was admitted for worsening neuropathic pain that was complicated by generalized anxiety disorder. She reports poor sleep and ineffective coping strategies, which all contribute to heightened sympathetic activation and increased pain perception, an experience that's commonly seen among individuals with chronic illness. The bedside nurse introduces two simple mindfulness-based strategies. First, guided breathing exercises and a structured body scan technique. These interventions require minimal equipment, no medications, and are appropriate for most hospitalized adults. The patient practices mindfulness for 10 minutes in the morning and evening, and she also uses the breathing techniques before invasive procedures or during pain spikes. Over a 2-week period, she reports meaningful improvements, decreased pain intensity, less worry, and better sleep quality. Physiologically, mindfulness reduces sympathetic arousal and activates the parasympathetic nervous system, lowering heart rate and improving relaxation. Psychologically, mindfulness enhances cognitive reappraisal, allowing the patient to respond to pain with greater emotional regulation rather than fear or avoidance. These outcomes demonstrate how mindfulness equips patients with self-regulation skills that complement their medical treatment and promote holistic healing. This scenario aligns with current evidence showing that mindfulness-based interventions can reduce chronic pain, anxiety, and distress, while also improving coping and overall quality of life. Now moving on to Gene Watson's theory of human caring provides a strong theoretical foundation for integrating mindfulness meditation into nursing practice. Watson emphasizes authentic presence, compassion, and intentionality in the caring moment, qualities that mindfulness naturally strengthens. When a nurse practices mindfulness or teaches it to a patient, it enhances caring consciousness and helps the nurse remain grounded, attentive, and emotionally available. Mindfulness supports several of Watson's criteria. For example, it cultivates loving kindness and equanimity, which aligns with the first Karita process. It also deepens transpersonal presence, allowing the nurse to connect with patients at a holistic, relational level. By encouraging patients to explore their emotions with acceptance, mindfulness aligns with Watson's emphasis on allowing the expression of both positive and negative feelings. In practice, when the nurse taught the patient in our scenario a brief breathing meditation, this interaction became a caring, healing moment. The mindful presence of the nurse empowered the patient, supported emotional regulation, and reinforced self-efficiency. These actions reflect Watson's belief that healing involves unity of the mind, body, and spirit. Mindfulness enhances this unity, benefiting both patient and nurse in the therapeutic relationship. Mindfulness meditation has deep historical roots in Buddhist tradition, where it is known as sati, meaning moment-to-moment awareness, with an attitude of acceptance and compassion. In Buddhism, mindfulness is not simply a relaxation technique. It is part of a broader philosophical system aimed at reducing suffering through awareness, ethical intention, and understanding of the mind. Contemporary mindfulness programs preserve many of these core ethical foundations, such as compassion, non-judgment, and present moment awareness that originate from Buddhist teachings. These principles help guide how mindfulness is taught in healthcare settings. For example, the non-judgmental awareness central to Buddhist practice aligns with patient-centered care by encouraging individuals to observe their thoughts and emotions without fear or self-criticism. For nurses, recognizing the Buddhist origins of mindfulness promotes cultural sensitivity and helps ensure the practice is introduced respectfully and in an inclusive manner. Understanding these roots also deepens the nurse's ability to use mindfulness as a holistic intervention, one that supports mind, body, spirit, healing, emotional regulation, and compassionate presence. This cultural and ethical awareness strengthens the therapeutic relationship and enhances the quality of care delivered. While mindfulness is generally safe and well tolerated, nurses must follow several precautions before incorporating it into patient care. First, patients should be screened for a history of trauma or PTSD. Mindfulness practices that involve inward focus may trigger emotional flooding or distress in individuals with unresolved trauma, particularly when they are asked to observe internal sensations or memories. Patients with severe anxiety disorders, dissociative symptoms, or psychotic disorders may require significant modifications. In these populations, mindfulness should be structured, brief, and clinician guided rather than self directed. This helps prevent disassociation or exacerbation of symptoms. Cultural and spiritual considerations are also essential. Some patients may have beliefs or religious traditions that influence their comfort with meditation practices. Respecting these beliefs and offering alternatives ensures culturally sensitive care. For safety, mindfulness should begin with a short guided practices, such as slow breathing or grounding exercises, rather than lengthy silent meditations. During early sessions, nurses must monitor the patient for signs of discomfort, emotional overwhelm, or disassociation. Clear communication, patient readiness, and supportive guidance creates a safe and therapeutic mindfulness experience. Future directions for mindfulness and nursing practice include expanding high quality research, particularly randomized controlled trials involving complex clinical settings such as oncology, palliative care, and critical care. There is a need for standardized APRN led mindfulness instruction protocols that outline dosage, frequency, and safety screening. Integrating mindfulness into nursing education and unit based orientations could strengthen provider resilience and patient centered communication. Additionally, telehealth delivered MBSR programs may increase access for patients with mobility, geographic, or scheduling limitations. Evaluation of long-term outcomes, such as symptom reduction, adherence, quality of life, and cost effectiveness, will be essential to guide evidence-based practice. Future directions for In conclusion, mindfulness meditation significantly improved the quality of life for the scenario patient experiencing chronic pain and generalized anxiety. Through brief, structured breathing and body scan practices, she experienced reduction in pain intensity, better sleep quality, and greater emotional stability. These improvements reflect the well-documented physiological effects of mindfulness, including parasympathetic activation, reduced sympathetic arousal, and enhanced cognitive control. Mindfulness aligns closely with Gene Watson's theory of human caring by promoting authentic presence, compassion, and deeper nurse-patient connection. Additionally, understanding its Buddhist roots helps nurses appreciate the ethical foundations of non-judgment, acceptance, and compassion that support holistic patient care. Together, these frameworks reinforce the therapeutic value of mindfulness in strengthening mind-body-spirit unity. Looking forward, mindfulness meditation should be integrated more widely into nursing education, staff wellness initiatives, and patient self-management programs. Further research is needed on long-term clinical outcomes, culturally responsive adaptations, and best practices for APRN-led instruction. As evidence continues to grow, mindfulness meditation remains a powerful complementary therapy that can enhance healing, foster resilience, and support patient empowerment.